When I originally came out here, what you would call WMI was split over quite a number of different campuses, or different sites across the building, with only the major core of the institute within that building. And it was not, while it was recognised as one of the major institutes in Sydney, it was not independent as such of the health service, didn't have its own governing board. From being what was a relatively small institute with lots of peripheral nodes encompassing different bodies of research, they've managed to bring it all together so that you've got a number of coherent groups of themselves, each with their contact back into the hospital, each of them where people who are providing clinical service are also contributing to the research output, getting that up to a stage where it's now ranks as one of the biggest institutes in Australia. And that's quite a feat. But the most pleasing thing has been to be involved not just the creation of the independent institute, but seeing the development of the new building, because that is going to create a quantum leap in what can be done in medical research on this site. In Sydney, it is the best developed model in which medical research relevant to patient care and patient care of the highest academic standard are going on together. What you're really talking about is the R&D of the health system, and that's why it is imperative that the medical research endeavour and the hospital translation are side by side partners. Now, you can't do good research if you don't have that infrastructural support underneath you. And the team that's been amassed here contains some amazing people that's been a pleasure to know. I think I've probably got more out of it than I've put in, and I'm just grateful for the opportunity of coming out here. Not being trapped on the M4, but for the opportunity of coming out here.